Health segment today, we are getting answers about the coronavirus pandemic. And it really feels like as this goes on, people are having more and more questions about it.
So we want to get you as many answers as we can because we have questions too. We wanted to welcome Dr. Arvind Venkat. He's an emergency physician at Allegheny Health Network and also the president of the Pennsylvania College of Emergency Physicians. Thank you so much for being with us.
Thank you for having me.
I think as we're really settling into this at-home stage, a lot of people are starting to wonder, how long can this really go on? How long can this virus continue?
So unfortunately, I don't have a good answer for you. This isn't like seasonal flu where we have information that it'll last for a few months and will pass. That's obviously the hope, but we don't have that information yet.
Is it, we talk about social distancing. In fact, we're doing it right now.
Mm-hmm.
We're farther away than we would normally be, and that's important to do. But should you do it in your own home? Like say, for instance, you have an elderly relative that lives with you, a father or a grandparent, and you're out and about, you know, trying to keep away from people, but you're going to work. When you come home, should you stay away from them?
So it really depends on whether you have symptoms.
Okay.
If you're not having symptoms of fever and cough and body aches and the like that you'd expect in this type of illness, then at home you can do your normal activities with the enhancement that you have to be very careful with hand hygiene. So washing your hands more regularly, doing it for 20 seconds, doing it thoroughly with soap and water is a great way to protect yourself and your family. But if you do have symptoms, then that's when we talk about the self-isolation even within your own home from family members.
We talk a lot about senior citizens and the elderly possibly being exposed to this and having the greater risk. But we've also heard a lot about diabetes, and that was something new that I had heard just at the end of last week and how this can affect them.
So it does seem that patients with diabetes can be more severely affected by this disease. And so I'd say for anybody who has diabetes, it's important to be careful to really practice thoroughly the social distancing and the hand hygiene.
No matter the age on that?
So it seems to be more in the elderly, even children with diabetes. We haven't heard a lot about really bad cases, but that doesn't mean it isn't happening or won't happen. So I would caution everybody.
Let's go back to if someone in the house is experiencing symptoms, or if someone is a suspected case, but they're not in a hospital. What should you do in your home to try to isolate that person? And then who do you appoint one person that like goes in and brings them food and cares for them, or what kind of precautions should you take?
So you already have the answers. You gave the information that I would probably relay, which is that if you have someone at home who has these symptoms, they should try to confine themselves to one room and ideally a bathroom that is right adjacent to it, that the individual who's bringing them food, who is bringing them anything else they need, that it's a single person, that person's being very thorough with their hand hygiene. If the person who has symptoms has to leave that room, that's when a mask may be appropriate. We don't need masks just sitting here together, but someone who has symptoms wearing a mask may be helpful in terms of preventing transmission.
Doctor, you're a parent. As a parent myself, I know that when my kids are sick, if I'm sick, you know, we're all in it together kind of thing. So how do you do the isolation realistically at home if you're a parent and you've come down with symptoms?
So it's very challenging, and what I would say is that we all just have to do the best we can.
Right.
The good news is that this illness doesn't seem to affect children as severely as it does older adults. And so in a home environment, if you have family members who are sick, obviously try to practice the distancing, but as a parent myself, I'd find it very hard to do so, and I would just try to be as thorough as I can with cleaning and separation as I can be while still caring for my child.
What's the best information right now about how long this can stay on surfaces? Because I've read a variety of things. I read this morning on plastic 3 days, and then I've heard maybe take your shoes off when you walk into the house because you could be trailing it in. What do you have to say about that?
So most of the studies that have talked about how long the virus can last on surfaces have been done in very controlled environments. And so a lot of these articles that say it may last for 3 days or longer, it's not necessarily the case in the real world where there's sunlight and other environmental conditions. But what I would say is this is a time for everybody to be very hygienic. So we take off our shoes when we enter our house, and that's been a habit we've had for a long time. I think washing your hands thoroughly when you enter the house, wiping off doorknobs with Clorox wipes is all very important.
I just have to ask from a medical standpoint, when we're at home, it almost feels, I don't want to say absurd, but we've never gone through anything like this, so it feels very unnatural. But these are the appropriate precautions to be taking, even if they do seem extreme.
Yeah, absolutely. I mean, this is not an ordinary time, and so we all have to be just much more thorough in what we do.
And what are you all doing? I mean, you guys are the frontline
Right.
warriors, and we have so much respect for, especially right now, what you're doing. But you take as many precautions as you can. But what's it like to be going to work these days?
Right.
So I'd say my colleagues in emergency medicine, it's a combination of determination and concern. This is what we've trained for. We are used to taking care of patients who are very sick and with diseases that are new. At the same time, we all have our lives, we all have our family members, and so it's a situation where we try to do the best we can, but this is our calling. This is what emergency physicians do, this is what emergency nurses do, this is what EMS providers do. And so we're very grateful that the community is trying to support us as best we can. And I can promise you that as emergency physicians, we'll be there for the community as well.
And that's why we've heard some of those situations where you should call your PCP if you think that you have symptoms of coronavirus. You should call ahead.
Yeah, so what I would say is that the best advice now is that for those who are relatively well and young, if they have symptoms that they think might be COVID-19, if you feel that separate from COVID-19 you would not seek emergency care or primary care, it may be best to just ride it out at home and monitor your symptoms. But of course, if you're having worsening shortness of breath, lightheadedness or dizziness, if you don't feel like you're acting right, if you're not eating and drinking appropriately, that's when you should seek care, whether it's calling your primary care physician or going to an emergency department.
Thank you so much for joining us today
Yeah.
and answering the questions, because, I mean, even though not all the information makes you feel great, knowing the information is such a powerful tool.
And thanks for what you're doing as well. We need to get good information out.
Thank you so
All right.
much.
Thank you, Doctor. And keep watching for our Eye on Health series right here on PTL. It always happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield together with Allegheny Health Network for your health.